Now turn it over to Vice Chair Lawson-Remer.
Great. Thank you so much. I appreciate the speakers. Just want to give a little context here. I brought this forward because we all know that we continue to face a crisis with mental health care workers in our county. And the big question that we have to grapple with is how do we ensure that we have enough mental health providers in our workforce to ensure that everyone who needs care can get the quality care that they need and deserve. And this is a complex issue because I think Kaiser's approach to trying to sort of grapple with the shortage, the severe shortage we have of mental health care workers, is to try to squeeze more out of those that we do have. And I understand, certainly understand our caller from Kaiser. I understand how difficult of a situation that we're all in. And I know that personally, I used to be a Kaiser patient and I switched in large part because I could not get a therapist. So this is a very personal story for me. However, in the very big picture, we are not solving our crisis of mental health in our county or in our country if we're burning out providers, if they are so overworked and overtaxed in trying to provide patient care that they can't do a good job with the patients that they do have, and they eventually burn out and leave. We are then contributing to an ongoing spiral of losing more and more good people in a profession that desperately needs more and more good people. And at the same time, we're undermining the care of patients because they're not able to receive quality care from their therapists if their therapists are, trying to multitask, sending appointment notices and looking at doing other sort of patient management work at the same time that they're trying to focus 100% on the person who's sitting in front of them. So this approach of cutting hours undermines current patient care and contributes to burnout and our widening spiral of losing quality healthcare professionals. So this is the wrong solution to a shared problem. We absolutely do need more healthcare providers and more therapists in our county. We need to think much more ambitiously about how to get there. And we get there and we get to a place where we're actually able to provide the mental health care that people desperately need by increasing wages, increasing benefits, hiring more people in this profession, helping people get the training that they need to enter this profession that can take years and is really difficult. That's how we solve this crisis, not by trying to squeeze more out of and squeeze more juice from a lemon that there's nothing less to squeeze. So that's why I brought this today. I think it's really important that we as a county take a position because we are ultimately the behavioral health provider of last resort in San Diego County, and this is a really critical issue for constituents and for people across our region. So with that, I'd like to make a motion for my colleagues to support this item. Thanks.